COVID cases in King County. It will include a brief update on COVID cases, and then we will be discussing public health and King County's work with businesses, workplaces, and restaurants to help control the spread of COVID-19. News media, you will be able to ask questions directly by using the raise hand function in Zoom. So find the raise hand function at the bottom of your screen and use that. And I will be calling on reporters during the question and answer section that follows the two speakers. So again, use the raise hand function if you want to get in queue to ask a question. Again, our media briefing today has a brief update about COVID-19 cases in King County, and then we will be discussing the work of public health and King County with businesses, workplaces, and restaurants in helping control the spread of COVID-19. We will have two speakers today. The first will be Patty Hayes, the Director of Public Health Seattle and King County, and the second is Hugo Garcia, who is the Executive Program Development Manager in the Department of Local Services and a co-leader of the COVID-19 Business Task Force. I will reintroduce them before they speak so you can get their names. So first up, we'll have Patty Hayes, that's Pattyhayes, Director of Public Health, Seattle and King County. Patty.
Thank you so much. It's a pleasure to be with you all this morning. First, I want to give you a brief update about the COVID-19 pandemic here in King County. And I will refer you all to our dashboards, which we continue to improve on a weekly basis. We'll put that out so you'll have that address for those. And we have recently put up a video on the use of the dashboards. It's our commitment to making our data useful for the community, and the dashboards are a primary way to do that. So our case counts have been decreasing a bit since July 25th, but I want to say that we remain at a 7-day moving average of about 140 cases per day. This is way above where we were in early June. So we continue to work diligently to both keep our messages out about what we need to do to prevent the spread. Younger residents under the age of 40 remain the largest portion of the cases, although we continue to see some of the above 40 starting to creep up, which we would expect. We continue to see the disparities in rates of infection by race and ethnicity, with some communities of color experiencing 3 to 5 times higher rates of infection. We do have a specific dashboard on that, and it's critical for these communities in our work with them to really have a focus on how we can help them be successful in bringing the infection rates down. Our 14-day average of new cases is at the same level as we were around the end of May. And for the indicators that we have to meet for the governor under his orders, we are not meeting our incident rate, which is 25 new cases or less per 100,000 residents over the last 14 days. Our current rate gets upwards towards 100. Right now it's about 91 cases per 100,000. This is a really important metric because it puts the number of cases in the perspective of our population. And that is being watched from everything from how we're doing overall to my work with schools on their questions. So while the healthcare system is still in good shape, that can change quickly. And we're still worried about the trajectory, particularly as we move into the fall, more people being inside, and that's when flu season will start. Even if we have a vaccine as early as January, I want to caution that doesn't mean that distribution widely will happen at that time. We are in active planning with the State Department of Health to prepare for when a vaccine is available. We'll be excited for that time, and we're starting that planning. So public health has a plan for the health of the community with an eye towards COVID being with us for a long time. I think we have to think about it, particularly when we talk to businesses about this over the long haul. We know the economic shutdown and its impact it has on businesses also causes additional health impacts, particularly as low-wage workers are pushed further into poverty or homelessness through job loss. To address some of those hardships, we have stood up our business and other community task forces, and they've been working tirelessly with impacted community members to access resources and understand how to keep themselves, their employees, and their customers safe. So I'm excited to announce what we're calling our STAR program. It was a number of weeks ago we realized that not only did we need to work with our restaurants and our community on how to protect their employees and to protect the public, but it's a great outreach and way for us to highlight those employers and restaurants that are doing a great job. So the Safe Start for Taverns and Restaurants program conducts visits at restaurants, bars, and taverns throughout King County. Leading with education, our environmental health experts will assist food establishment owners to understand the Safe Start requirements during our Phase 2 operations, as well as identify and enforce where corrective action may be necessary. To date, we've completed over 423 of these visits, and we're happy to report that the majority have fully or partially implemented important prevention measures. We're highlighting and celebrating exemplary businesses where prevention measures are being met or exceeded on our blog and social media accounts. We know that if businesses are able to put prevention steps in place, this will reduce the risk on employees, but also the larger community. We find that it can be very hard to pinpoint where each infection person caught the virus. So that means we need to focus on preventing the spread in all locations. We need businesses to see their role in preventing the spread among workers and any visitors or customers. And the sooner we're able to work with businesses when they have cases, we can prevent further spread. Early intervention has proven successful in settings like our long-term care facilities, so the same principle is critical for restaurants and other work sites, and relies on these strong partnerships we want to have. So what else can business do to help protect our community? And I've talked to the chamber about this and other businesses. Those that are able to do telecommuting, we would really recommend that businesses support telecommuting options right now. And many large employers have already moved this and announced it. King County itself has announced the keeping telecommuting at least through early January for those who work for the county. So we need to also ensure with our businesses that sick leave policies that they have are encouraging employees to stay home at the first sign of illness. Additionally, we really do not want employers to require negative test results to return to work. Testing asymptomatic people puts an unnecessary burden on our testing facilities, leaving less capacity for those at higher risk. And there's actually the guidance through the Centers for Disease Control that gives the best guidance in this way to employers that can be used instead of testing. So we know that public health is here to partner with businesses, and if there are workers or customers who test positive, we want to be sure and help these businesses with any questions and to be able to put their business back so that they can keep operating. So with that, I'll turn it back to Keith.
Thanks, Patty. Next up, we're going to hear from Hugo Garcia. Again, that's Hugo and Garcia. Hugo is the Economic Program Development Manager at the Department of Local Services and a co-leader of the King County's COVID-19 Business Task Force. Hugo.
Thank you, Keith, and thank you, Director Hayes, for sharing the information. I really want to start off with just acknowledging and recognizing that our businesses, especially our small businesses, are in an extremely tough spot. They're having to constantly make painful financial decisions on top of tricky calculations of employee, community health, and safety. Um, it's challenging. And as someone who's an immigrant who's here today because of a small business that my parents ran, um, I know how important and critical it is for us to make sure we support our local small businesses. And the purpose of the Small Business Task Force is just that, to ensure that those cornerstones of our community, the small local businesses, are not alone in their decision making, and that they have all the resources, the guidance, and the support they need during these trying times. To date, the task force has done outreach to community small business owners, specifically in unincorporated in South King County, since early on in communication with a lot of our business owners, both large and small. We analyzed that a lot of the bigger cities, Seattle, Bellevue, and a lot of the cities in King County already had initiated outreach immediately. And we just wanted to make sure that the smaller businesses in smaller cities and municipalities, especially in South King County, where we know the BIPOC community business owners are being pushed out to the most, and that would be the Black, Indigenous, and people of color business owners. We want to make sure that they also receive the information just as transparently, as quickly, and in their language as fast as possible. So we provided weekly webinars from the very beginning in late March, early April, right when PPP programs from SBA started getting announced. We started doing webinars every Friday, and we did them also in language, multiple languages. We've done them in partnership with the Office of Immigrant and Refugee Affairs with the City of Seattle, did them in multiple East African languages, and multiple Asian languages, Spanish. And we're able to just get the word out to folks to understand what resources were out there, what's happening as soon as possible, so that businesses also had a chance to ask questions to get clarity on a variety of issues. And it ranged from financial information to what are reopening guidelines, as well as distribution opportunities of PPE as well, and what to do if your employees or your workplace tests positive. So we really focused on outreach to the folks that generally don't connect with the municipalities or their local governments as much. That's really has been an emphasis of our task force, knowing that a lot of the great municipalities and city partners already are doing this great work. So we wanted to make sure that the unincorporated areas, and if you can see behind me, that's actually a map of King County, and we have a breakdown of all the different areas of the county, both in the cities, which are in the gray color on the map, and as well as all of unincorporated, which is 250,000 residents. It'd be the second biggest city in King County if all of them were together in one area, both in rural and urban settings, as well as the entire island of Vashon. So we also set up a financial assistance, technical assistance program and grant program. We were really focused on making sure that it went out to the unincorporated and South King County cities as soon as possible. We really managed and rolled out and facilitated the grant program for unincorporated King County, as well as a one-on-one technical assistance hotline and online webpage, so that folks could connect with a community lender. We identified two nonprofit CDFI, Community Development Financial Institutions, that have been doing amazing work in filling in the gap that of small business financing that banks aren't able to reach. So we were able to set up a hotline so someone can call in and get just a little bit of guidance. Most business owners, if not all, really are very, very resilient. They know what they're doing, but they just need to know that they're heading in the right direction. And a lot of times that's what we want to make sure we're there for. We additionally did advocacy with the Washington State Small Business Recovery Working Group This is a group that included the head of the state financial institution department, the Department of Banks, as well as Commerce, City of Seattle OED. With the support of the executive's office and the council, we were able to make sure that we advocated for improvements to the PPP funding program to make it more accessible to folks so that it could be used for other needs, not just employee payroll services, but other needs as well, and to extend it to nonprofits as well. So we really tried to focus on helping a lot of the small business owners and staying in touch. We have weekly calls where we talk to different business owners and sectors of the industry, as well as chambers. We did a partnership with the chamber, small business chamber communities, South Sound Chamber with Andrea. Chambers from Redmond have been extremely helpful. Did a partnership with Amazon Treasure Trucks and deployed over 14,000 small business masks and sanitizers to over 400 businesses across the unincorporated King County, as well as cities across the county as well. This was the first time that even the treasure truck themselves, the Amazon Treasure Truck, had even gotten outside of the city of Seattle. They went to Vashon, they went to Skyway, to White Center, and were able to provide hundreds and hundreds of masks. We did kits that included up to 200 masks, both disposable and reusable, as well as multiple sanitizer bottles to each business owner. We've done rounds of outreach as well to areas in rural King County, Falls City, out around Enumclaw, East Federal Way, between Federal Way and Auburn as well. So we really try to just be in constant outreach and support for our community, business community. On the horizon, we'll look to continue to do PPE distribution to ease the financial burden of businesses that need to provide these to their employees. We recognize that this is a long-term crisis that we're in, and we're definitely want to be there for the long haul. Partnering with Greater Seattle Business Association and the Office of Immigrant and Refugee Affairs continue to do the outreach to our communities of color, supporting advocacy efforts to also expand outdoor capacity for businesses. You've already seen some cities, City of Seattle, the City of Buren, and others have already started to do right-of-way expansion so that businesses could put tables on sidewalks, can do, if they're adjacent to alleys even, and sometimes even in their parking lots as well. So we're looking to do the same for the unincorporated areas of King County and continue to support the work that needs to be done. And with that, I will hand it back to Keith.
Thanks, Hugo. So a reminder of what's going to happen next. We'll take questions from media, and the way you get in queue to ask a question is in Zoom at the bottom of the screen. Use the raise my hand function, and we'll call on you from there. You'll get in the queue. Again, the raise hand. When I call on you, I'm going to ask you to state your name and your organization, and then ask your question. So we'll unmute you at that point in time. We're going to go until as long as about 11:30. At that point, we're going to switch gears, and we're going to repeat a portion of this briefing in Spanish for our Spanish-speaking community as part of our engagement to make sure that we are engaging broadly in King County. So looks like we've got someone in queue right now, so we'll start out with that question. This is Nick. And I'm going to unmute you now, Nick, and go ahead and ask your question.
Can you guys hear me?
We do.
Great, good deal. Thanks so much. This is Nick Popham from Como TV. Director Hayes, this question's for you. I was wondering, you had mentioned majority of places that implemented these safety measures, they've done it successfully. Do you know how many out of those 423 visits or so haven't met those standards? And are there any specific areas within the county where you've seen more violations, where it seems that people aren't getting the memo?
Thanks for that question. So when we say the majority of them, we're seeing a very few. I haven't looked at the list in the last week, but I know that originally there were just a very, very small percentage that really had not been successful at any of the requirements, and we actually focused on those to get those facilities back, those restaurants back in compliance as a priority and working with them. Most of the restaurants are doing a really good job with things like requiring the staff to have face masks, the setup they're doing. So it's we have looked at some of these really high priority areas, and really it's not any one part of the county or another. I would say that the challenge for taverns and bars is higher. There's a relationship with alcohol consumption and sort of compliance with wanting to wear masks and et cetera, as you can well imagine. So we have actually been concentrating first with taverns and bars to help them. They're open because they serve food, and so we want them to be aligning with how to manage within that environment.
Thanks. And we have another question in queue here from Steve. I believe it's Kiggins. Steve, I'm going to unmute you now. Why don't you state your full name and your organization, please?
Hi, good morning, everybody. I'm Steve Kiggins from Q13 News. Thanks for taking my question. I'm wondering if you can identify maybe the 2 or 3 commonalities that you're finding in some of the violations, where some folks either are having issues with acquiring PPE, or if there's really some kind of bonehead, like something that was an oversight, or something that is more serious.
So I'll start that, and Hugo, if you have anything to add, that'd be great. So one of the things that's been confusing for restaurants is the requirement for them to keep a list for people to say, I am here in your restaurant, and give their name and contact information. The governor at first made that a requirement, and then he made it voluntary for the person to write on this list, but left it as a requirement for the restaurant. That originally was meant for help with public health if there was an outbreak, and we could follow up easier with contact tracing. So that's been a confusing, that's one of the highest non-compliant elements that we found. But to tell you the truth, that in terms of the safety pieces of all this, that was the one that I was least concerned about. The one that we've been working more on is are you following up with the distancing and the things that I said that we're finding more in compliance. I think the other thing that's really challenging in restaurants that we're having to help them a lot with is how do you keep, as much as possible, staff physically distancing themselves. You can well imagine in a kitchen, that's very hard, but we are finding that is a real challenge with the restaurants. And then thirdly, the issue of how you deal with customers, wearing masks, and then being in the restaurant and following what we need them to do, that we need to support restaurants in that, because not all customers are interested in coming in with a mask on or having a mask available. And so we've been helping them with that. So it kind of runs the gamut of that. Any restaurant that is struggling with how to do the seating blocks and all of that, which can be a problem, we can help them with the spacing and ideas for how to help so that they're keeping the tables in the right order.
Yeah, I'll echo what Director Hayes has mentioned, and a lot of that communication with a lot of restaurants and food service business owners early on was getting access to PPE, and that's what we worked on to get millions and millions of masks out as fast as possible, helping them with understanding how to put up signage to both internally for employees and externally for customers. So it's really focusing on echoing what Director Hayes has mentioned. I know that a lot of business owners, especially immigrant business owners, being able to translate a lot of the information has been a challenge. But I know that we've added a lot of resources on the Safe Start King County webpage to support that, and we're doing outreach to do that as well. So yeah.
Thanks, Hugo. Patty, there was a follow-up from Steve. Just wanted you to clarify the requirement for a customer name and contact. What exactly is required there?
Yeah, so the requirement is for the restaurant to have a list available so that as customers come in, they can write their name down and their contact information. So the governor's order requires them to have that as an element. What's optional is for the customer to actually write down on that list and give their contact information. And that was what the governor changed early on when he was putting out the Safe Start requirements.
Great, thank you. Our next question is from Nora. Nora, I'm going to unmute you, and could you please state your full name and the organization you're working with? Thank you. And you're up now.
Hi, good morning. Can you hear me well?
Yes, we got you.
Thank you. My name is Nora Girondolce from M Radio Live. And I have just a small question for Patty. Thank you, Patty Hayes. About highlighting the businesses that are doing an extra good work on following all the personal protection measures, etc. Will there be a way for the public to find frame of honor or a list of these positive businesses so we as public feel safer to visit them, to promote whatever they are doing, and creating some way of positive competition between businesses to achieve these good levels of protection for the public and for employees? Is there a way to find out where they are?
Yeah, so we want to highlight so that these great employers who are modeling the way for other restaurants, to highlight them. So what we've been doing is putting it out in social media, and you can find it on our public health Twitter or my Twitter site, which is Patty Hayes. Purple Haze, sorry, it's Purple Haze RN is my Twitter handle. So please follow me, and you'll see that I highlight these restaurants, and we give the owner the opportunity to comment or to have a picture involved so that they can show and talk about how they're caring for their community and how they're caring for their employees. So it's exciting, and I know it's exciting for these employers to have us do this. We know there's lots of these restaurants out there. So we want to make sure every week we're getting to different ones, we're highlighting different ones so that the list that we're highlighting gets longer and longer and longer as restaurants are doing a great job.
Thank you very much.
Thank you. I'm going to take one question from our Facebook audience and then go back to the queue on Zoom. So the Facebook question, I guess this is for you, Patty, also. Will there be regular testing of employees regardless of their symptoms?
So it's a great question about testing. And of course, you see a lot on the national level and the federal level about the issues with testing, particularly in other states. Right now, we do not recommend that employers test employees to come back to work, as I said earlier. There is not a need right now to be testing asymptomatic people. we do, when we have a case and we are doing our contact tracing, if somebody has been exposed to COVID, has been exposed to somebody with COVID, we work with that person to schedule the testing so that it's done at the right time when we would expect the virus to start showing up. If we start testing just asymptomatic people, they're not within the right window, and we're actually not using our resources to the best. So right now, that's where we're at with testing, and we are working diligently to expand our testing for the folks that we really need to get tested and need to get tested in that right spot and right window.
Thank you. Okay, back to the queue here. We have Asaya. Asaya, I'm going to unmute you. Please state your full name and your organization and then ask your question. And you are unmuted.
Thank you. Can you hear me? Can you hear me?
Yes. Yep, we got you.
Hi, my name is Asaye Abune, and I'm a part of Washington African Media Association. We are 10 organizations in media, radio, TV, and also social media. I have a concern regarding, the minority immigrants, especially in the small business areas where there is a lack of, cultural issues and language issues. I think there's not enough work done in that area. Still, we need more translation, more reaching out to community. I'm not seeing, I know you mentioned that, but still there is an issue really just, working together with King County and reaching out to community. What kind of coordination can we have, to educate the community? Is there any financial support or fund or anything? Thank you.
Thank you.
Thanks. I can start with that for sure. Definitely. Thank you for the question. We very early on wanted to focus on making sure that outreach, as I mentioned, myself being an immigrant and growing up in a small business, I know how important it is to get information, and historically information gets to our communities of color, immigrants and refugees not as quickly. It is because of translation difficulties, and also because as an immigrant and refugees and persons of color, going to government is culturally not something that's easy or as common in our cultures. So we have done webinars to 3 different languages in East African languages: Triganian, my apologies if I mispronounced it, Somali, and we're looking to continue to do webinars to do just that. We work closely with our Speakers Bureau, which helps us to coordinate outreach to our immigrant and refugee communities. We've done outreach as well into large neighborhoods that have population. We did distributions of masks and sanitizer, but like to all our business owners, it's just a lot of information, and we do need to be consistent. So we will continue to do outreach as well. You can also find our one-on-one technical assistance program that you can look up in our King County website, and that would be kingcounty.gov/local business help. It's the Department of Local Services where I work has 9 languages, including the 3 in East African languages on the website, that has a service to do one-on-one coaching and consulting with a business specialist that will have an interpreter as well available so that folks can connect with somebody in their language to get helpful answers and questions, answers to the questions. Additionally, we do have our King County Compliance and Business Hotline. That's the number 206-296-1608, where folks that have inquiries in general can call there, and you can get connected to our one-on-one webpage for one-on-one consulting and get those answers and information in language. We look to definitely partner. We'd love to connect with you as well. Please send me an email, I'm sure, after the webinar. We'd love to maybe get information out directly through the partnership that you guys have. We have done some collaboration with Rainier Avenue Radio to do outreach to Rainier Valley, since we know a lot of the East African community from refugees and immigrants are in South King County along Rainier Ave, Skyway. So please send out an email to me. That's hgarcia@kingcounty.gov, and I'd love to share with you. Today we're doing a webinar. It's going to be in English, but we'd love to do any follow-up webinars in more languages that we've done in the past.
Thank you, Hugo. Next up, we have a question from Sue Romero. Sue, I'm going to unmute you, and you can state your name and your organization. This may end up being our last question before we go to the Spanish briefing. If we have time, we'll do one more after this. Sue, you are up. Oh, you're muted. Unmute you. There you go. Sue, are you there? We'll move on to the next question. We're a little short on time. Okay, let's go to the next one. Next up is Baraket. Baraket, you are going to be up next. Could you state your name and your organization and your question?
Thank you. Thank you. My name is Baraket Kiros. I am the chair for CIRC, Coalition of Immigrant, Refugee, and Communities of Color, and also a chair of 21 organization COVID-19 response. And I've been on this webinar many times, and also I am on the pandemic response King County Advisory Group. I have two questions in regard to this COVID, the pandemic response. The effective of school closure on COVID-19 transmission is well established. We're not going to argue on that. However, school closure for a long period of time may have a detrimental on social and health consequences for children living in poverty, and they are likely to increase the existing inequalities. The closure also are likely to widen the learning gap between children from low-income and higher-income families. And children from low-income household, as you know, Patty, often live in a condition that makes schooling very difficult. Parents who work may not be able to supervise the learning and add difficulties as well. How do we address those concerns is one of my questions. And on the second level, which is the same thing, but during the COVID-19 school closure, it is important to place issue of equity at the center of remote learning plans with increased guidance for special population, for students who have disabilities, transit and homeless students, a guidance for supporting a variety of vulnerable population. What is your plan addressing those concerns? I know we've been together many times on a different level. So those are the concerns that I have for now. Thanks, Patty.
Yes, and those concerns are universally held by both public health and the school districts. The closure of schools or the status of schools is one of the hardest things within this pandemic, because we know that children need to be in school. They need, especially with the younger children who don't do well with distance learning, or the other children that you've mentioned that are disadvantaged. So I'm working with all the school districts, have regular meetings with the superintendents. It's been clear that the Office of Superintendent of Public Instruction has made it a requirement for these school districts to identify children that have either special needs or special circumstances, and what are they going to do about that. And many schools are developing different methods for having to look at, in this time where they're starting with remote, on how they work with families that are in circumstances where remote learning is not working and not a great environment. We know that the impact to childcare is really big, and so we're working to try and get partnerships between childcare organizations and the schools Some of the schools are using the opportunity to have their buildings open and to use the space in there to address some of the issues that you brought up. So this is going to be an evolving issue, which is why most of the schools have said that they're starting with remote, where in no way are the schools saying they're going to be permanently in remote for extended period of time. We're working with them because right now the levels of as you reflected, the levels of COVID in the community are so high that the risk of outbreaks in the school, and you've seen this from other schools in other states, is just that risk is just so high that the schools would be closing down all the time because of the COVID. So this is just a horrible balance that we're having to walk right now. And we need to work together with the schools to figure out how to address all of these issues.
I'll add to that briefly, just because we're all connected, education and businesses and communities connected. I'm very close to supporting our educators. One of my brothers is an educator. Another of my brothers is on the school district. He's the director for Holland School District, recently got added there. And we know that all these families are going to be staying home with their kids more often. And we acknowledge too that businesses are going to have to shift to support those families. We're seeing that more and more businesses are delivering services and products to neighborhoods, to parks near neighborhoods. You're going to see more, in essence, the resurgence of mobile food trucks that are already starting to go out to neighborhoods, not just downtown cities, but actual neighborhoods to provide services and food. So I think we're definitely trying to be supportive of municipalities that are trying to be proactive in getting the resources to the families, to the educators, closer to them in their neighborhoods than at the actual facilities, since we know that right now things are fluid.
Thank you for adding that. Thank you both, Hugo Garcia and Patty Hayes. It's 11:30.